So whenever you are ready, go for it, Mr. Dan.
Uh, Good morning. So fair warning, I turned on transcription and recording, so whatever you say or whatever I say will go down in posterity, so be kind in the chat. I'm a little bit self-conscious today. I had the Dennis the Menace thing going where I had a colic sticking up that I haven't seen since I was like 12. So, but I'm recovering. So ESSER coding. Well, when this project was started, there was reference in the law to evidence-based practice and targeted subgroups, but no explicit guidance on how to capture them or what was going to be asked. And then we had a secondary request from the legislature that said, how are we going to measure the impact of the interventions that are put in place, or how are districts going to measure the impact of interventions that are put in place in order to know if they were effective. And then we had a third imperative that came out of Dr. Mathis's office, and that idea was that the academic recovery plan was a dynamic document that it was meant to be ongoing, and that as people's got feedback on the intervention or found things to be effective or ineffective, that they would adapt the plans. So our challenge was to come up with a coding system that would accommodate all those different stakeholders' needs without being too much of a burden on schools and districts. I don't know that all of those goals were accomplished because I've gotten plenty of feedback that people weren't super comfortable with the amount of coding that had to go into PowerSchool. So what we've done is tried to balance all the different needs. So what is this all about? It's trying to minimize the amount of coding and maximize the utility of the data across the stakeholders group at the district, state, and federal level, and have us be ready to meet those needs. So why are we coding this? Well, as it was pointed out yesterday, most of these grants are extensions of other grants that actually have performance measurement requirements in the law. And I think this was referenced in the Tanya Smith's memos where they had they sent out the data requirements for grants reporting. But here's actually the law that's driving it, that there's supposed to be the federal award. It has to include specific program goals, indicators, targets, baseline data, data collection, and the expected outcomes. So we're supposed to know why we're investing the money in a particular group of students or a particular program, what the goals of that are, and did it in fact accomplish those goals. With the presentation yesterday, you saw some of the money expenditure was making cleaner schools, and it was very clear that money spent on cleaners and different things met that goal. But when we're talking about measuring changes in students' performance, especially after a period of interruption in instruction, it became a much different challenge. So here, what we're talking about today is the system that got derived in order to accomplish that. Okay. And again, one describes the state's responsibility and the federal agency's responsibility. And then the other says, look, these same things have to be applied to people that are receiving subawards or sub-grants of the original grant. So whether it was the federal requirement that they set up performance goals that cascaded to the state. In the same way, those performance goals cascade to the LEAs that receive the funds. So there's where the mandate for identification of those students and those programs and our ability to measure the impact came from. Is that, any questions on that?
There haven't been any in the chat yet.
Okay, well, I was doing the teacher pause thing, but it's all good. So how do we code these? How do we start to identify them? Well, there's been several sets of guidance that have been issued. One is around the development of the plan that was issued by Dr. Mathis's office that encouraged the analysis of the base data and the identification of targeted subgroups as required by the ESSER law to one, analyze your base data and determine which subgroups needed interventions if there was any disproportionality in the response. So if in some programs, it was obvious that we needed a better way to deliver internet services to people in poverty because they didn't have the capacity to provide digital instruction. In other cases, you had special ed services where, hand over hand requirements basically as their primary mode of instruction. And yet other groups where you had ELs and other people that were directly impacted. So when you were devising those plans, you were supposed to go through and look at measuring the impact on those. So in order to accomplish that goal, we had something called the Rally tool developed, and that was a district state vendor partnership where the districts signed up to have their interim assessments delivered directly to the vendor without it going to the state. And in other words, at that point, the interim assessment data was the districts, and we kind of developed a system that insulated the state from receiving those because we didn't want it used for accountability purposes. So one way to do that was to make sure that we didn't have it. So that's how the Rally system was actually developed, where they looked at the targets based on the student's prior assessment history and said, look, if COVID never happened, then here's where the student would be scoring or was projected to score on SC Ready. And you developed a target goal. And then went through and said, all right, since we know what their targets or what their likely scores were to be, let's compare that to how they're doing on the interim assessments. And the interim assessments were converted to an SC Ready scale. And then you could actually see the difference between where a student was projected to score pre-COVID and where they were scoring on the interim assessments throughout the year. And we tiered that so that people could have a quick identification of who the most heavily impacted students were. And it was done in two ways. One, that tiering was done in an RTI-like fashion, where you had 80, 15, 5. 80% of the students would have been kind of a tier 1 identification, and then 15% of the students were in a tier 2, and then the most heavily impacted were in tier 3, so that you could look across subgroups and see where there were the largest proportion of tier 3 students that would need interventions. So we did that to support the analysis requirement of your academic recovery plan. We also broke the data out another way where they were reported in quartiles. And again, looking at that gap between where a student was projected to score and where they actually were scoring, it was broken into most highly impacted quartile, moderately impacted, mildly impacted, and then lowest impact quartile, where they had the least variance from where they were projected to score. So we provided two different mechanisms for identifying those subgroups that were disproportionately indicated, right? And that was all of that identification and analysis was supposed to take place in the development of the academic recovery plan. Well, the next section of the academic recovery plan is that implementation, where you're going through and doing the things that need to be doing to change your students' trajectory. And then the last part is where you evaluate and reassess. So in order to evaluate and reassess, you have to know who you delivered the treatments to, and that's where the PowerSchool coding came into. So the decision was that these would be entered under the special programs tab in PowerSchool, and the PowerSchool coding manual talks about how to do that. And that was not a perfect measure, because if you're in an after-school program that meets once a week versus after-school program that meets 5 days a week, the dosages would be different, even though the enrollment dates would be the same. But we didn't want to force the creation of classes or sections inside of PowerSchool where you could do that like daily attendance measure. We wanted to keep it, again, at a sustainable level, and chose to just do start of program, end of program in the special programs, and then say, look, beyond that, districts would know whether or not they were talking about a program that met once a week, once every 3 weeks, or 5 times a week. So in order to accommodate the differences in those descriptions, we said we're going to create a code called, let's say, S or A, and then we're going to provide the districts an opportunity to build a data dictionary or a coding dictionary, if you were, so that in District 1, S or A might mean after school programs that meet 5 times a week, and S or B might be an intensive reading program that was intended for EL students in order to provide a bridge on 2 things. One, their academic ELA gap, and additional support for academic progress towards proficiency. So, we didn't force a uniform coding system across each different type of intervention. We just said, look, we'll provide standardized codes, S or A, S or B, S or C, S or D, as many as you wanted, and you tell us what those means inside of your PowerSchool instance. So that allowed us to share with the EOC or with Education Analytics, the people who did the Rally coding, a way of grouping those students together that had received a particular treatment, either by district or by school, depending on the level of granularity that you applied to the program identification. So I believe all of the ESSER pots have the same performance requirements, that they have particular goals and that those goals are cascaded down. But it's specific. I know that it's called out in the federal requirements for reporting that the targeted subgroup intervention be included in ESSER 3. Or Jen, what's the official name of ESSER 3? American Recovery Plan, ARP? Is that right?
Correct. We call it a ARPSer.
Yeah, ARPSer actually calls out for reporting by subgroup and how those funds were targeted. So what we were describing as a methodology was well aligned to the requirements that actually came out afterwards for that coding. So American Rescue Plan. Thank you, John. So going back to those academic recovery plans that came out through Dr. Mathis's office, districts should consider differentiated goal for grade bands, specific grade levels on students with mild, moderate, or significant academic impact from the pandemic that correlated with the tier 1, tier 2, and tier 3 designations inside of Raleigh. And your plans were required for strategies to meet the goals, a description of how each of those were met, and then a goal timeline, and then evaluation. So if you're looking at a spring to spring goal and you're evaluating your progress toward that goal, and you determine that it's not meeting it, I mean, it doesn't mean you immediately flush what you're doing, but you should at least look at, is this the path that you want to continue on? Because at some point we're going to be called to speak to the way that we've invested a tremendous amount of money that has been provided in order to support students. The other part of it is a little bit sadder consideration, and that's in 2024, most of this funding is going to stop, right? And that means at some point we are going to have to prioritize the interventions that we're providing to students and decide where we're going to keep investing the more limited dollars that we have. So the other hope for this coding project was to provide a measure that will allow districts to, when the ESSER cliff comes, to make plans going forward as to, what they're going to keep, what they're not going to keep, and what their return on investment is. So what was asked for? Well, I described the coding dictionary, right? I asked for ESSER A, ESSER B, ESSER C. So naturally, at least one district decided to call it ESSER 1, ESSER 2, and ESSER 3, which we had avoided because of the nomenclature of ESSER funding pots as 1, 2, or 3, but they did it anyway. That's one of those best laid plans. But this particular district chose a very broad descriptor, right? They just said ESSER, our primary identification is going to be academic remediation. And they said, academic ESSER funds were used to expand the number of students targeted for academic remediation, including before, during, and after school. Said it was a K-12 intervention and it was supposed to report ELA and math. So if you're looking at coding like this, where it's an incredibly broad level, right, we can still report by school, grade, and district that these were the students that were coded in ESSER 1. But when that particular district gets called on to report, all right, was this effective? Was this ineffective? Unless those interventions were all the same, they're still going to have to dig in to say, all right, well, here's how this particular program worked. This particular program didn't work. So I would say that this one is a little bit too broad, but it met the letter of the requirement. So well, almost met the letter of the requirement, but that's that becomes a secondary reporting burden on their side. But those were the general asks that we had for the coding dictionary. And some people were very, very thorough and got down to ESSER AA and ESSER AB, where they were going incredibly granular on the different programs, which should make reporting out on the impact of those programs much easier, but represented a large burden on the front end for identification. So this is one of those that you get out of it what you get into it. If you do the work on the front end, then it should make reporting easier for evaluation of the individual programs on the back end, because we'll be able to give you more granular response data by ethnic group or whatever the composition was that you were looking at. So this is the PowerSchool screen that we're talking about. Like I said, it was a very, very deliberate choice to use special program enrollment. This is from this is not a real student. I just watching to know I'm not violating any FERPA stuff here. This is from a documentation inside of a PowerSchool manual. And in order to do this, you have to go into the particular student, you put their entry date into the program. If they're done, you put in the exit date. Otherwise, I think it defaults to end of year. And then you select the ESSER program that it's involved in and hit submit. I believe that we can do bulk enrollment with those, but I would have to ask with Wyatt if I'm making that up or if it's true. But if you've kept them in spreadsheets, I think you can still do a bulk enrollment around the different ESSER coding in order to upload it into PowerSchool. Okay. So going back to the map for success that Dr. Mathis's office put out, we started looking at, what are do your interventions align with the goals and stuff that your district has set and your school has set? Do they reflect your priorities in terms of, if you chose reducing class size as an effective measure in order to put more direct communication on, is more direct instruction, is that sustainable? Can you measure the impact on it from year to year? And are you going to be able to implement it? If you didn't have an abundance of teachers before, the idea that you're going to put in a plan where you're increasing the number of teachers available is a little bit of a paradox. But it goes to the type of goals that you choose and how you're going to measure the output for it. Okay. So where are these data going? Well, the data are intended to use for school district leadership for evaluation of their ESSER plans or their academic recovery plans, where we can give you queries that allow you to pull out the students impacted and map them to their results, whichever result set that you're looking at, whether it's identifying the students and how they did on SC Ready or SC Pass if you were choosing an academic intervention, or the number of incidences that they were involved in if you're talking about a behavioral intervention. Where the data are shared with education analytics so that they can be included in the rally results and identifying the your ability to change a student's trajectory, not the expectation that they would be back on track within a year or even 2 years, but did we change the trajectory from, are they is their learning lag getting larger and larger based on where their expectation would have been 2 years from now? Or have we changed the direction where we were seeing it increasing to now seeing it heading up the other way, where that gap from their projected score and their current score is decreasing? It is being shared up with the legislature. And at some point, there'll be a reconciliation between the money spent on a particular program and the impact of the program. And at the very low level, a headcount level, I believe it's being used or can be used for federal reporting, where the ESSER plans, ESSER identification will allow you to do head counts by demographic group, as the federal reporting seems to indicate. So I lifted the evaluation plan that said, how we, if you spent money on evidence-based after-school programs, right? Was it available to all students? Right? If the answer was no, then it was a grade level target, and you put the number of students that were max allowed to be served by the program. Then you have to indicate the head count of students who participated, right? And it doesn't specify the level of participation, right? So I take that to mean if they were enrolled in the program and served at least once, then they participated. Other people might say that they had to meet some kind of dosage threshold in order for the impact to be measured. But I don't see a specification in the federal requirement that says what the duration of the participation had to be. Jen, are you familiar with the federal reporting?
I am not as much of an expert as a couple other people. Let's see. Sydney or John, are you on this call? Or are you available to talk, I should say? Doesn't. As
Sorry, I should have planned on this being interactive with. Sorry.
No, it's okay. It's okay. All right. So I apologize. What was your question again? I was looking.
So is there a minimum amount of participation in the program in order to say the student participated? Do they have to meet a threshold number of days to say that participation occurred?
That is an excellent question. I don't recall a minimum, but let me message our experts on the annual report. They're actually going to be, and if I can't get a hold of them right now, they are actually our presenters at the end of the day.
Okay.
Well, so that would be an excellent question for them.
So then I'm going to defer the further question to them. But I believe that as long as a student was eligible, enrolled, and participated at least to some degree, because then the ESSER coding that you've done will allow you to match the special program code to these demographics categories and allow you to do this reporting fairly easly, because you'd use you'd pull up the ESSER code that or the ESSER codes that were your evidence-based after-school programs, And then you'd have the SUNS number of Power School IDs of those students involved. And then you call up their demographics, and it's a relatively simple join to put in the number of students in the subgroup that are participating, because you put them in the special programs designation, and the number of eligible students in LEA at the subgroup. It is, again, this is a gap, at least I'm reading it as a gap in the report structure, is they don't specify at what point when you're looking at the span. Right, so I would probably use the 135 or the 45th day as the baselines, and you can grab those right from our website or from your own Power School queries. But at any rate, that ESSER A, ESSER B, ESSER C should be fairly easy to break up into these buckets as you identify the code and then do the required reporting. So it should make it easier and we should be able to validate it. So when doesn't this apply? If you've got a whole school that's engaged in a particular program and everybody is participating, then there is no particular need to do that Power School student level coding, because everybody in the school is identified by definition as being a member of the school on a particular time. So again, we wanted to reduce the reporting burden when you had programs that were school-wide, and still make it something that you could put in place when you had targeted subgroup interventions, you know, and be able to identify the different buckets that were used to pull them out. So really, that's the extent of the requirement for Power School coding and the purpose for which it was designed. And I'm gonna say one more time, is there any particular questions that people have around this? So I've either dazzled you with brilliance or you've gone back to sleep. Okie dokie. So
Well, I was just gonna say, I heard back from one of our experts about the annual report, and they said not that they knew of as far as a minimum number of days.
yeah, that's what I thought. And in general, the feds don't weigh in at that granular level. So if you've done the ESSER coding as we've called for here, there should be a fairly easy lift to do the federal reports and allow us to report to the other groups as required. So there isn't a whole lot more to this. And I'm not hearing a whole lot of questions or feedback around it. That's really all I've got for today, Jen.
That's all right. You've given us so much information. I think maybe you did dazzle people with it. I was dazzled.
All right, well, that works for me. We're here to answer any questions people might have, and I don't want to create filler for something that isn't there, but that is the extent of the current reporting that are required for the ESSER coding.
If people do come up with questions, would you like them to email us and have us forward it to you, or would you like them to just be able to email you directly? Which is your preference?
So we actually have powerschool@ed.sc.gov. And they are the people that would be most able to directly support these questions about how to do it in PowerSchool. And then for changes in your strategic plans and your your recovery plans and your ESSER plans, I think that would be a combination of Dr. Mathis's office and maybe the ESSER offices, if you guys monitor those plans, right?
We do monitor the plans. Yes, we monitor the plans and the spending plans, but not so much the coding. That's why I was so excited to have someone who knew what was going on with the coding, because we've had quite a few questions about it and we are not as equipped to answer those questions.
Yeah, like I said, it was a real, it was a debate at how to minimize the burden we put on districts and still provide the information they need to do this reporting. And that's why we settled on the special program enrollment. So I'm going to pass it back and give people 20 minutes of their day back, I think.
All right. So, thank you. I appreciate it. So our next speaker is